Let's get some analysis. Anthony Cox, reader in clinical pharmacy and drug safety at the University of Birmingham, joins us now live. Good evening to you, sir. I wonder what you think about this ruling from the EMA.
I think it's a really good, sensible ruling based on good science. So the European Medicines Agency is a world-class regulator. The UK was in EMA up until Brexit. I know that the MHRA and EMA still speak to each other as you'd expect. And after a week of somewhat confusion and different policies in different countries, it's good to see this today after the evaluation of the adverse events that have been suspected to be linked to the vaccine to come out. I think really all the countries in Europe need to look at this report and think about restarting the vaccination campaigns as soon as possible.
It's one of the issues, isn't it, that when something happens, like the death of a woman in Denmark who was vaccinated, the blood clot issue, that gets reported. The media, and I'll say this, as part of the media, we report things in one way and sometimes we sensationalise because that's the nature of the business. What we're talking about, though, and I think this is what you're getting at, is that if you look at the hard science and what the regulators are saying, then obviously there is an amount of good sense there as well. What kind of checks would they have made, do you think, in order to make sure that when the EMA speaks about the AstraZeneca vaccine, that it is actually sort of on the money and correct?
Right. So when a new vaccine or a new drug hits the market, we only know a certain amount from the clinical trials because the clinical trials are relatively small. So for AstraZeneca, there were around, over 20,000 people, which is big for a clinical trial. But in terms of very rare adverse effects, we need to see the vaccine used in the population. So when the vaccine is rolled out in big vaccination campaigns, we need to have reporting systems in place. So EMA and the MHRA and the FDA will, for their vaccines as well, have in place procedures and plans for how to analyse the suspected adverse effects that arise. And we encourage people to report these effects as well, because we want to know about them. And then we have a plan to look at them, analyse them, decide whether it is linked to the vaccine, and then communicate any risks that we find back to the public. And it's really important to note that even if you do find a risk, it really depends on the nature of the risk, how serious it is, how common it is, what the action would be. Because clearly, I've just been watching your news channel and seeing some of the lockdown that's happening in France, and a new person admitted to ITU every 4 minutes. Clearly there is a massive risk here that we're trying to counter with the vaccine. So vaccination is just so important. And I think with all of life, there is uncertainty. So the EMA and other regulators throughout the world, when they look at these events, they have to do the best they can with the data they have. And these, the thrombosis, the blood clots that we're seeing, the number of them isn't more than you'd expect in the normal population who have a blood clot. 1 in 1,000 people in a year would have a blood clot normally. It's lower than that in the people who've been vaccinated. 17 million people with the AZ vaccine. And then there's these more rare blood clots in the brain that have been found, which are linked with a platelet disorder, very rare platelet disorder. And they're in the number of less than 1 in a million people. And EMA have looked at this and they still haven't been able to prove a link between the vaccine and the event. But even so, they're taking precautions and advising people that if they have a headache that continues for more than 4 days, or a bruising on the body except where the injection was done for obvious reasons, then they should go and seek medical help. But it is so rare, less than 1 in a million, and COVID kills 1 in 100. So the balance of safety here with the AZ vaccine is plain to see.
I've been holding my tongue and letting you explain these things because I think it's important to give you the room to clarify what you mean. Because when you talk about a blood clot on the brain, people will hear that and start saying, why don't I ask you a question? I want to ask you a question about the risk of that. But you developed it and explained it very clearly, I think, that as the EMA has been saying, as the WHO has been saying, the World Health Organization, the benefit outweighs the risk. Can I ask the typical journalist's sensational question? Would you, sir, have the AstraZeneca jab?
Yes, I would. And my parents have had the AstraZeneca jab, and I'm very happy they have had it. And as well as being an academic and a scientist, I'm actually vaccinating people. So I have these discussions with people at the weekend when I work in the vaccination hub. And sometimes it can be difficult because as humans are storytelling creatures, and that's why we like things in the news, and that's why we gravitate towards strong stories. And if you have a vaccine and then something happens after it's been given, it's natural to, you sort of see that link between one thing and the other. But you've got to remember there are millions of people receiving the vaccine, and a certain number will have things happen to them after the vaccine that may not be linked temporally. They may not be linked in a causal way. It's just, we just see that story. And I remember the rare events I've talked about, the cerebral sinal thromboses that EMA have talked about. They can occur in nature normally as well. So there are issues around whether these are vaccine related or just events that have happened to people after vaccination that would have happened anyway. So it's hard to say with clarity whether it is linked or not. But I mean, EMA have been really cautious. They're an excellent regulator. Europe should be proud to have that regulator, and I do hope that all the countries that have paused their vaccination restart.
As you say, 17 million people have had the AstraZeneca jab across Europe, and as the company says, no link to be found to those blood clots. The EMA backing that up. Anthony Cox, thank you. Reader in clinical pharmacy, drug safety as well at the University of Birmingham, and as he pointed out, he's giving the vaccinations to people as well, having the conversations, allaying their fears and explaining to them what it's all about. The best possible guest we could have had for this topic. Anthony, thank you for joining us, sir. Pleasure to have your time, your contextualisation of what's going on, and of course your analysis. Anthony Cox there joining us from the University of Birmingham.